today we're going to try and talk about prevention, which is the other thing. So it's cure to prevention. And when you look at the statistics around prevention, it's crazy that we haven't really prioritised this for years, because if you put money into prevention, you save money down the line, and it's very, very clear that it's the best way of really making the nation healthier, and also making the NHS less busy, and also making people live longer. So that's where we come from. So I was then thinking and discussing with Alex about prevention, and in physical prevention, so for physical health prevention, there's some very, very clear things that we can do. Now, probably the most important thing is to make people equal. I would say that always trumps everything else, and that's really why I got into politics, really, because I realised how important that was. However, also in physical health, there's smoking, there's exercise, there's weight, and many other things, and diet, which we know about and we can instrumentalise. The one thing that struck me is that there's not that much in the cupboard around mental health, and I hope people will hear a few things today. But how can we prevent mental health problems in this country from getting to the doctor, to the NHS, and make people happier, dare I say it, or certainly less mentally ill, if you like. So this is what this is about, and I think that social prescribing and creative health generally is actually uniquely placed to do this. So prevention can be in a number of different places. It can be before you even get to the health service, and that's the best place to have it. It can be when you're actually seeing the doctor, but you perhaps don't go down the medical route as well. And so you can put prevention into various parts of what we do. But I do think that we have got a unique opportunity here to get involved in the health of the nation, and specifically, there's a lot of physical health benefits we can get from creative health as well, but there's also some really profound mental health improvements. So I'm not going to go on too long because we've got so many great experts in the room. So we were going to be recording. I don't know if it is or not.
Yes, we are. Unfortunately, we've had to leave the laptop there, so sorry.
Okay, so yeah, I'm on, and a couple of you are there on. Yeah. So hello to everyone online as well, and thanks for coming. I'm sorry about the IT issues there as well. So okay, so and then just a couple of quick housekeeping things. So at about 3:20, we're expecting the Minister for Public Health and therefore Prevention to come and give us a 10-minute chat. So we'll look forward to that. That's Ashley Dalton, so she'll come there. So if we're discussing something and she comes, we'll probably break off and just allow her to speak, and then allow her to go if she needs to, because you know what these ministers are like, many of you. But anyway, so first of all, what I'd like to do is I've got a couple of keynote speakers I'd like to introduce, and then we have some round table speakers, and then we're going to open it up to the floor and have a general discussion. So I'll try and share it as well as I can. If you want a sort of point of order, i.e. you're not happy with the way things are going, please just put your hand up. And I'm not a very formal chair, let's put it like that. Okay. But first of all, I'm delighted. So I am the chair of the APPG, which is All Party Parliamentary Group for Creative Health. And I'm really glad that I've got my vice chair next to me, Lord Kamall, who's a very, very senior member of the House of Lords and a Shadow Minister for Health and Social Care. So, yes.
Well, thank you, and thank you, Simon, and thank you to the APPG, and thank you for all of you online and in person here today. I just want to probably tell you a little bit about my own journey in terms of getting interested in this area of creative health. Some of you may know I was one of those ministers a few years ago, a health minister whose diary is controlled by my private office and civil servants. One of the things I became interested in during my time as a minister was both Sally Greengross and Lord Howarth would make points about creative health and social prescribing, and this was completely new to me as a minister. But I was very interested as well because I play in bands. I play in old band rock bands. I played in bands for quite a long time. I'm not good. That's why I'm an amateur musician. And this is why I stick to politics. And one of the things you do realise, especially when you play live and you play to an audience and you connect with that audience, sometimes they call it being in the zone. That's an incredible moment, just being in that zone. They're responding to you, you're responding to the audience. And it's a feeling that I've also had other times, for example, when you are meditating, for example, that you know that all this sort of, and you know this is all good for your health. And one of the things I became more interested in is this sort of, if you think about the Venn diagram, the intersection between music and health. And just started talking to my colleagues more about it, attended events. I was invited by Intergenerational Music Making to get involved with them. They do now, and now they're doing some work with Intergenerational England. They formed Intergenerational England. But I've become more and more interested in this area. I am not an expert, let me add. I'm just someone who happens to be a very bad musician and someone who's a shadow health minister, and looking at how I can combine those two things. But I think it's fascinating areas. I mean, if you think about the way music touches all of us, the way it actually gets through to your soul, frankly, at times, and you can be incredibly moved, and it can change your mood. But also, it can take you back to a memory, a different place in space and time. It could take you back, for example, to a parent or a lost friend or some moment like that. And then, of course, that opens up huge potential for things like Alzheimer's and dementia. And I know there's been a lot of work done on that. I remember at one time I was speaking to the organisation Music for Dementia. And I just think there's so much untapped potential here. So when I was asked to try and be part of this group, I was delighted to be asked, because I'm not an expert and I want to learn more from all of you. And the other good thing about this, if you think about the fact that as our population ages, as we start to see mental health achieving parity with physical health, it's been an ambition, but not actually quite realised, and we're pushing on this in the current mental health field. One of the things that becomes really important is how do you get the staff to do this sort of stuff, or the experts. And what's interesting is we now want to move away from that whole model of you have to try and phone up the GP at 8 o'clock in the morning to try and get an appointment, and then only to be triaged to either pharmacy or secondary care. Now, things like pharmacy first help in some ways, but what happens? Does it always have to be a medical or a therapeutic intervention, as it were? And one of the things that's really interesting about this, if you think about all the musicians out there, all the actors, the artists, and others who are training for that big time, while they're training for that big time or waiting for that big break, they could retrain as a therapist. And in fact, some of them who do train as therapists decide, actually, this is what I want to do. This is far more fulfilling than trying to, be a huge rock star going around the world with playing to stadiums full of people, or getting an Oscar. Well, maybe not, but the point I'm making, that actually I did not realise how fulfilling this was. And one of the things I find that talking to art therapists or music therapists or drama therapists is how fulfilling they find their job, and how they feel lucky to have that role. So I think there's lots of different things coming together here, if you like. I haven't got a sort of a systemic way of looking at this, but I think if we really want to change our health system, and I'm completely on board with what Wes Streeting says about going from analog to digital, from back to local, and from cure to prevention. Those are really important treatment to prevention. Those are really important things. And I can see a massive role for creative health here, but I just need to learn more from all of you. So thank you very much for inviting me.
Yeah, thank you. Well, that's fantastic. When you're saying about that sort of moment of a connection with the audience, I think I just had this vague thing of something that dancers in Spain have called duende or something. Has anyone heard of that? Where there's a moment where something suddenly flows in art. So maybe that's what you were feeling then. So thank you for that. Now, one of the absolute joys of my new life as an MP is that you get to meet some of your heroes. So one of my heroes is in the room, Professor Michael Marmot, and I've been following your work for years and years and been inspired by it. And you're one of the reasons that I'm not GP anymore. I'm an MP, although I did do a surgery yesterday because they were short. But Professor Michael Marmot, thank you for coming.
Well, thank you. And to echo what you said, prevention is about a great deal more than telling people to behave well. And the problem is that's tangible. Well, if we could only get smoking rates down another 2%, try and deal with child and obesity, very important. But prevention is about much more than that. What we know, and you began the afternoon that way, is that health follows a social gradient. The greater the deprivation, the worse the health. I've been saying for some time that the opposite of poverty is not wealth, it's justice. And in my American review of social determinants, health equity, we talked about a life of dignity, that the aim of the work that we do should be to help people create lives of dignity. I quote Amartya Sen. His entry into the freedom debate is not the libertarian. We can see what techno-libertarians, what havoc they're wreaking in the United States right at the moment. But his approach to freedom is to create the conditions where people can lead lives they have reason to value. And it's highly likely that if you ask people, what is a life that you value? They would not simply say an indoor loo or enough to eat. They'd want something more than that. When we launched the Creative Health Report, I cited the Joseph Rowntree figures that in 2022, 1 million children were living in a state of destitution, a 2.5-fold increase in 5 years. Destitution being defined as doing without 2 or more of housing, heat, light, food, clothing, and toiletries. That's pretty basic. And I don't take a kind of Maslow view that we don't need to worry about a meaningful life till we've got all those basics right. As I said when we launched it, man does not live by toothpaste alone. It's important to have toiletries, but it's important to have a meaningful life. And part of a meaningful life is engaging in activities beyond the very basics. And being creative is part of that. I had 2 visits recently to Manchester Camerata. One was at Wigmore Hall, where they performed music which I could not describe or understand, but I'm sure it was very good for me. But it passed me by. There was a little bit I could hang on to, but most of it passed me by. But the other was in their home, in, I think, a converted monastery in Manchester, and I trekked out to see how they were providing music therapy to people in dementia. I said to the chair afterwards who'd invited me, I said, I was so impressed with your musicians, how long they could spend squatting. I thought I couldn't spend that long squatting, I mean, but they were terrific, and it was wonderful. So what I'm talking about is that we need to deal with the macro. We need to deal with the fact that we have 1 million children living in a state of destitution, and that ought to be an important aim of policy. But we also need to deal with the micro. We need to say, what can we do to help improve the quality of people's lives? I did a webinar this morning. It's been a busy day, with the chief scientist, Dame Angela McCay. And I was asked about AI. I always get asked about AI these days. I got no particular insight into it. But what I said was 3 things. One, like any innovation, in the early stages, it has the prospect of increasing inequality. That's what usually happens. The rich or favored get it first, whether it's a vaccine or a new technology, electric vehicle or whatever it is. It has the prospect of increasing inequality. The second is, I'm not a Luddite. It's a labor-saving device. It's going to change things. And the third is, who's in charge of all those data? You can see what happens when the techno-libertarians hack into the Treasury data in the US and get control of individuals. But let's go back to the second. And one of the people on the webinar said, well, if it's going to take jobs away, what are people going to do? I pointed out that the southwest region is a Marmot region, and I went to Taunton, and I walked along the high street along the way to County Hall and counted 14 hairdressers. And I only walked for about 8 minutes along the high street. So I was slightly regretful. I had to turn off to the County Hall. I wondered how many more hairdressers. Is that what we're going to do? We'll all be out of work. We'll cover each other's. And then I thought, as one does, about Keynes's essay in the early 30s, the economic prospects for our grandchildren. And he rightly predicted that GDP would be 6 or 7 times per person what it was in the 30s. What he got wrong was he said, we'll only need to work 15 hours a week. Now, being Keynes and married to an opera star, he thought we'd all be going to the opera, whatever. I'm not quite sure that's what we should all have in mind. But the point being that we don't need, we've got this strangely segregated labour where some of us work all the hours that there are, and some have no work at all. Some of us have intensely meaningful jobs, and others have jobs that are not meaningful at all. And so I was asked, well, what kind of jobs do you imagine people doing? I said, well, Oxfordshire is a Marmot county. I was in Oxford yesterday, and I was introduced later in the day to 12 community health activists. And they're not just on health, they're looking at housing and education. And I noted the fact they were all women. I thought, I asked, do you exclude men? No, they don't. But women dominate the caring professions. And these were meaningful jobs, improving people's lives, people in adult social care, education. These are meaningful jobs. There's all kinds of things that people can do that are far more fulfilling than being the kind of fodder in the workplace that too many people now are. So I think we need creativity in thinking about the social change, as well as creativity in the nature of people's lives.
Thank you. That's fantastic. I particularly like the man does not live by toothpaste alone, because I think that's it does actually bring about, why do we want people to be healthy? What are they going to do with their health? And I think that's really good. And also, interestingly, talking about jobs. So that's quite a key thing. And obviously in government at the moment, there's a push to get more people working. But we want to do it in a way which is supportive. So I think the arts has a real role in that, certainly. It's a gateway to getting back to work. So thank you for that. And obviously, we'll have further discussion going forward. But that was really, really informative. And something about a life of dignity, I think, is also incredibly important. I'm actually having a terrible time. Last 6 weeks, I've been assisted dying. About getting some dignity in dying, and whether you agree with it or not, I've got to dash off at 4 o'clock at the end of this. But I think dignity is such an important word in healthcare. So thank you for that. Now I'd like to go on to our roundtable speakers, I'm afraid I'm going to limit you all to 5 minutes. And what I'll do is, when there's 4 minutes, I'll just put my paper up like that. All right. I'm sure you're not like this, but one of the problems in Parliament, parliamentarians talk too much, I think. So I'm just going to be very, very strict with that, because I think it's really important just to make sure there's plenty of time to discussion. So I'm not being rude, but I will stop you at that moment. So that's great. So first of all, under the prevention, communities and public health, I'm delighted to introduce Dr. Justin Varney-Bennett, who's a Regional Director of Public Health in South West. So thank you, Justin.
Thank you. So I thought I'd kind of structure this in a sense, first of all, acknowledging the role of creative health. And I think one of the ways when we think around the impact that potentially the arts have on our health is we forget that the WHO defined health as the physical, mental and social well-being. And this concept of social health is something that in the UK we haven't necessarily explored as much in other countries, but it's one that I think creative health speaks to you very strongly and bridges some of your opening comments about how does this fit in creating mental well-being and positive mental health. But also when we talk about creative health, we're talking about a massive spectrum, and quite often we end up in the art therapy part of the spectrum. We forget about public art, our exposure to targeted, curated and facilitated art experiences and creative experiences, through to those things that are co-created with individuals and communities and co-explored, and then at the furthest end of the spectrum, the art therapy space. And all of those have value, all of those have potential benefits for the health of the population and public health. But we often go straight into the targeted, co-created interventional space rather than considering the wider landscape in society. There are huge opportunities for creative art to interface and creative health to interface with communities of place. And again, I think one of the areas, and it speaks to what Michael's been saying around the wider role in relation to place, employment. Artistic organisations are often anchors. I was previously Director of Public Health in Birmingham. We have multiple museums and theatres. All of those are fixed in place. You can't lift and drop a museum and move it around the city where it needs to, potentially to more deprived communities, how they operate in the context of communities of place. But also we have artistic organisations that significantly and specifically interact with communities of identity and communities of experience and have particular expertise in creating communication, trust. They have relationships of trust and ownership with those different communities and their cultures. And that's a huge opportunity for public health. And many of us, particularly during COVID, maxed out on how could we engage through those expertise and those expert relationships with communities of identity and experience, because we know that top-down messaging just wasn't cutting through. And so actually working with cultural organisations that were rooted in those communities was really key. I think it's important we also acknowledge the challenges. Much of my career, I've been in and out of working in creative health, working with Alex and others in various different guises. And we still haven't quite got the narrative right on measuring impact and demonstrating impact in a way that those who are commissioning understand, and how we bring both sides together. And the sector for a long time has been driven by Arts Council funding and core arts funding, which is looking for different things, and actually how we work. And I think some of the great examples we're seeing of cultural commissioning compacts and community collaborations to help individual organisations understand how to measure in a way that fits the needs of the public purse. The challenge of recurrent funding, no one wants to fund infrastructure, and that's probably across the voluntary community sector and very true in the creative arts sector as well. So you bounce from individual project to individual project. How do we move to a way in which this is more sustainable, but recognising the public sector when it's funding sustainable delivery, is funding sustainable delivery, and therefore needs consistency in outcomes and results. So finally, just thinking about the future and how we frame some of the conversations around prevention, public health and communities for the future, understanding the arts and health do not operate in isolation to the wider context of arts and society. The public sector is facing significant financial challenges. I could just about say that as a civil servant. But in terms of the reality of how do we do more with less, and how do we make sure that what we're doing is the best value for money, and that where creative arts are the answer, that they're competitive and they demonstrate that value for money. That we're in an environment of huge societal challenge and discourse, and that the creativity of the arts sector can help us both to understand how people are experiencing these types of change, but also help us co-explore how to come through them. So finally, I suppose I reflect on that as we go through our discussions today, we have to keep in mind the universal exposure to art, where it's built into our society, the paintings that sit on the wall, through to where we're doing interventional commissioned work. And how do we recognise that that interventional work will only ever touch the tip of the iceberg? And actually how as we society relate to creative arts, particularly in periods of societal change and challenge, will ultimately be what sets the bedrock for our future generation of populations.
Thank you, Justin. That's really good, and it's interesting the differential between the universal and the commissioned, and I think that's something that we'll perhaps bring up a little bit more. I do. There was some statistic about the arts sector employs more people in the car industry, doesn't it? And which, so it's an important thing that the actual jobs in it as well. And that, you know, someone said about the NHS, one of the best things about it is it employs 1.5 million people, and the actual job is in itself quite good for people. So yeah, thank you for that. So next we've got Cedric Whilby, chair of the Southwark Centre for Health and Wellbeing Partnership.
Well, it's actually Southwark Cultural Health and Wellbeing Partnership.
Oh, is it? Sorry,
Not
yeah.
to worry.
Yeah, no, sorry, I didn't read that out properly. Sorry.
No worries. Firstly, thank you for the invitation. Like you, my hero is the man sitting opposite, so we'll talk more. I do want to sort of address this issue around prevention, what that means, but I thought I'm going to take you to a community centre in Bermondsey. Community centre where a dozen elderly residents or adults sit warily. Many haven't left their homes, and to the system, they're seen as expensive patients because they're isolated, depressed, and sometimes at high risk of hospitalisation. And my network, or the associate that I belong to, we managed to secure some funding from the council, Southwark, for a number of years to support some of these projects in terms of commissioning artists, creatives within the borough to support a number of different activities that looked at health and well-being, but look at it through the creative lens. Now, we began a simple sort of program where our participants participated in sort of remembering sort of activities on their memory. One woman, Margaret, who participated in the activity, I remember, she said, "I'm not an artist, I'm not creative." She stuck her two fingers up saying, "I don't want to be part of this." But by week 3, she was actually leading the activities, actually getting everybody involved. And most of the individuals in that group were not only just expressing themselves about what they do in terms of through the creative arts, but also through music and dancing. And what that actually event did for those individuals, it dealt with their loneliness, it dealt with their connection, it dealt with their resilience and their health. So it's about us trying to look at what are the realities for us as decision makers. Because what happened is that we've got 2 endings here, possibly 2 endings. The funding stops after 6 weeks. Margaret's group's disbanded. The GP who referred her to this group reports that she's back. She's on antidepressant. She's kind of feeling lonely, isolated, because of the funding stopped for 6 weeks. It goes back to what Justin said earlier about short-term funding. But we were lucky because we had a council, a local authority, that had a vision to want to fund this for a little bit longer. Okay, so it was a year, but 6 weeks is better than just a year. A year is better than 6 weeks. So I think there is an economic argument, and I think for me, the B's selection in terms of it's 10 times cheaper. £1. I have to look at my notes because I'm also, I can go on and then drift into something else. So I'm referring to my notes as well. I mean, £1 invested in the creative health is £2.90 in returns. Your own programme, Arts and Prescriptions, has the data on that, Simon. I think for me, I've noticed you put up the sign, so I need to stop and I need to kind of say my point. I mean, look, my thing is about we need more policymakers to make those decisions for us to make change. We need to relocate our resources. We need to challenge exclusionary funding practice. And we also need to ensure that when we think about investing in creative health, we think about our Margarets in our communities. I'll stop there.
That's brilliant, Cedric. Thank you for that. That's really, really good. And I think you're right about the long term. And we have to think of ways we can do that, because I don't think there's the funding there to continue it forever. But we have to try and So that's a really important point. And I also like what you said about people, Margaret say, I'm not doing bloody art sort of thing, but and then getting right into it. So there's an attitudinal thing that we need to do, and I found that a lot as well. So really useful stuff there. Thank you. Right, next to a old friend of mine, Pippa Jones from Gloucestershire as well. So Pippa is the director of Create Gloucestershire, and she's also with Naomi, who's the artistic director of GL4. That's at Matson, which is quite a deprived part of Gloucester. Yeah. So Pippa, over to you.
Yeah, we're doing a double act today. So I'm Pippa. Create Gloucestershire, we're a network infrastructure organisation. Thank you, Justin, for saying that infrastructure is hard to fund for. Yes, it is. We're on a mission to bring arts to more people and more places. And we're going to share today what we're doing in Gloucestershire to try and shift towards a prevention culture and how art has been at the centre of that. So the journey started 15 years ago. It's a long journey. It takes time to create the change that we're looking at. When we asked a question about if arts and culture, what would it be like if arts and culture could be prescribed as naturally and as easily as drugs and surgery to help people get better. So that was an innovation challenge because it hadn't happened in Gloucestershire before. And we now have a really brilliant consortium of 5 arts partners, Gloucestershire Creative Health Consortium, regularly funded to provide non-medical interventions to people who have a diagnosed illness. And there's facts of data to prove the impact of that. So our next step was really trying to think about how do we prevent illness in the first place, because it's better than a cure any day of the week, and provide that ongoing step down for people who were having, as we've said, that 6-week drop-off. What happens at that point? So you don't have to be ill or stay ill to access arts and health. And what we started to notice was the challenges in the system about shifting to prevention. It's everybody's business: housing, employment, health, faith, education, art. But we project manage in silos, we fund in silos, we evaluate in silos. So how do we create those spaces, those forums, those relationships where citizens and public servants can work together equitably to co-design solutions that respond to the very specific needs and assets and ambitions of those communities. It's also like prevention isn't a service that can be specified and delivered to or for people. It needs to grow and flourish within communities to be done with. But what we have found time and time again is that as a workforce, there aren't the competencies to work collaboratively. The relational skills and practices we need to work collaboratively aren't there. So we've had to, alongside our work in arts and health, really think about how we unlearn some behaviours and relearn some other behaviours about working equitably and working in a way that doesn't jump from the question to the answer, but allows some space to be able to come up with the new. The other real challenge we found is how commissioning happens. When you start to, and Naomi will share some of the ideas that have come up. So we've now got a new approach like micro commissioning, because a lot of the work that residents want to do is like £500, £100, and the cost of trying to secure that on both sides of the equation, both for commissioners and commission, just makes it not possible to fund. So we've set up, we're piloting and effectively a piggy bank. We're calling it a community chest because that felt a bit more grown up. A community chest where we've managed to get funding which the community decides upon. So we've so far distributed £31,000 that's gone to 44 different ideas, and the average grant was £700. But that has impacted 44 different groups of people in the community that we're working in. And so being able to have money that isn't decided upon by anybody except the people in the community means that projects get funded that are needed, they can be funded really quickly, and it doesn't require lots of red tape, which is what often puts people off. So I'm going to hand over to Naomi now, who's going to give us a bit more of the specifics of what, when we're talking about structured togetherness and that relational way of working, what that means.
So hi everyone, I'm Naomi Draper. I'm the Artistic Director and CEO of a community interest company in Matson, Gloucester. We've been running for nearly 10 years. As you mentioned, Matson's in the top 10% of socially deprived areas in the UK, and it's the largest social housing estate in Gloucester. It has a lower life expectancy, like you, I'm following my notes. So prior to GL4 starting in Matson 10 years ago, there was no cultural activity on offer for anybody on the estate. Matson's a really community orientated place. There's lots of amazing organisations there doing amazing things. But in 10 years, there's been two sort of new creative organisations that are set up, which is GL4 and another one called GASP. So as GL4, we programme 7 events every single year into the community spaces in Matson. So we transform the churches, the schools, the libraries, we do outdoor pieces, and we do everything on a pay what you can basis. So tickets start at £1, but it isn't about us trying to create an income, it's about giving the opportunity and raising people's aspirations. So if people can't afford £1, we don't care, just come on in. We always do a pay what you can system just to add that tiny bit of value to what we do, just because we find that if we offer it for free, people sometimes tend to not turn up. We also run a participation strand for young people. So we have after school dance provision and after school circus provision. And we've run 2 youth theatre groups from ages 7 to 16 on our estate. They're completely free as well. And then through COVID, we had to look at a new way of working on the estate and engaging with our community. And we done that through providing craft activities, so just bags on the doorstep and videos online for people to do stuff. And then out of that has came a craft strand in GL4, which is like hugely successful. And so we provide 6 adult craft classes a year and 5 family craft classes. And it's all about sort of bringing people together, allowing them to have fun, learning new skills along the way, and also changing the reputation of our area. It hasn't got a great reputation, so we're hoping that, you know, although we're based in Matson and we're predominantly want to aim at our community, we want people from outside to come in, we want people to see that it's not what they think. I also, as you've heard people talk about mental health, I've suffered with mental health myself. So I've suffered with anxiety for nearly 20 years. And I've seen a huge positive impact on my own mental health through engaging like in craft activities, going to watch shows. It always just makes me feel really good about myself. So I'm a sort of little case study that it works. One of the things that we've always said is that on our estate, it's really easy to access sports. You know, if someone wants to play football, or, you know, they can go find that really quick. And if that's not the case for the arts, growing up, you know, I've lived on Matson since I was 15. So growing up, we didn't have access to any arts or cultural provision. I'm not from a theatre background. If you'd have asked me 10 years ago if I'd have been an artistic director of organisation, I'd have said no. But here I am, I love it. We feel that arts should be accessible to everybody. So as Pippa mentioned, we run a group in Matson called Culture Matson, and it's been running for nearly 10 years, every 6 weeks, with there's about 40 people that sit on the mailing list for it. And we have everyone there from social housing, local police, play leaders, teachers, faith leaders, residents, debt advisors, youth workers, the NHS, they're all there. Everyone's really committed and sort of respects everybody in that space. And then we've been running the community chest for around 4 years. And it's just that sort of people don't come for the money. They were already coming, but it's just that now we've got a pot of money that we can really sort of distribute from ground level, from people that are really understanding the need of what people want, rather than it being sort of top down. And then everyone in the group sort of decides on how the money is spent and all stuff like that. So yeah.
That's fantastic, Naomi. Thank you. Really, that's a really good. I've got a flavour for what you're doing, and it's interesting what you're saying about reputation of a place, because I think particularly in Gloucestershire, Maxim has got a reputation as you described it, and arts has a way of saying actually it's quite interesting here, guys, and it will change how people feel about their own thing. So that's really, really important. So thank you, both of you, for that. That's fantastic. Okay, next we're going to move on to prevention and inequalities, although obviously that's been covered as well with that. But I'd like to introduce Professor Monique Lhussier, who's the Director of Centre for Health and Social Equity in Northumbria, who's come down from Northumbria this morning, I understand, haven't you?
Yeah.
You're right.
So I share two things with previous speakers. One, I have notes, and the other thing is I share in the worshipping of Michael Marmot's work. I also share your question about Maslow's hierarchy of needs, and I want to use a project to perhaps explain why that is. So I want to tell you about a project called See Me North, and there's three important things about See Me North. One, it focuses on chronic and repeated homelessness, so we're talking about some of the people who are the most marginalised in our society. Two, everything we do is co-constructed with people with experience. And three, I'm going to talk a little bit about trauma before circling back to clinical approaches. Okay, so adverse childhood experiences are childhood traumas which result from physical, emotional, sexual abuse, living with a parent with criminal justice involvement, substance abuse issue, mental health, or experiencing I've lost my train of thought, domestic violence, for example. The link between ACEs, so adverse childhood experiences, and the brain structure and function of children is really well established. ACEs lead to a shrinkage of the prefrontal cortex, leading to issues in planning, organising and prioritising our work, regulating our emotions, shifting our attention when required, or sustaining our thoughts when we need to. It enables us to have a working memory as well. All these things are referred to as executive functions. Executive functions are really important in daily life. So following ACEs, children often struggle to focus at school, for example, regulate their emotions and behaviour. However, these executive dysfunctions are rarely considered in adults. In research and in practice, we behave as if people simply grow out of them, and we are proposing that they don't. Research tells us that 90% of these experiencing chronic homelessness have experienced one ACE, 50% have experienced 4 or more ACEs. So logic would tell us that unless there's been some purposeful remedial, adults still live with executive dysfunction, right? But of course, trauma doesn't stop at 18, right? So if you've been chronically homeless, you've had repeated traumas related to loss, abuse, exploitation, as well as homelessness itself. So there's an accumulation of trauma going on. People nearly always have mental and physical health challenges and often addictions too, which impact on their executive functions further. So we're talking therefore about people who present with very, very complex trauma histories and very real physical impacts of this. Now, to give you an idea of what this looks like, Stephen is one of the experts I experienced to work with. Stephen, in his own words, lives on frozen pizzas. And that is because he cannot prepare beans on toast. I'll leave that here in a second. He cannot prepare beans on toast because there are too many steps, too many timescales involved. Okay? Carl is another one of our experts of experience, and Carl told us that he can remember vividly and in graphic details what happened to him when he was 6, but he doesn't know what he did yesterday. And Carl thinks his brain is damaged. And of course, what he's displaying is a short-term memory issue, which is an executive dysfunction. So people can struggle to express themselves with clarity and understand and retain complex instructions. They find it difficult to trust others. They can be driven by very, very strong emotions, which they struggle to regulate and rationalize. This means that, for example, what for you and I, to most of us, might feel like a minor hiccup in daily life, to them could feel like a major crisis, which means they feel rejected and their confidence and self-esteem is further eroded. Yet we expect people on securing a roof to be able to organise their house, cook for themselves, go shopping, manage their finances, open a bank account, register with a GP, apply for jobs, make appointments, remember them, turn up at them, remember the information they get given and act on that. We expect people to tell their story with consistency and clarity all the time. Now, I could keep going, but you get the idea. that for somebody who cannot make beads on toast, all of these daily, day-to-day tasks can be really overwhelming. We understand homelessness in terms of the absence of the relief, but not in terms of the traumatic events that might have led to that and the very pragmatic day-to-day impact of that. The findings from this work package will be developed into a toolkit for trauma-informed care, and that fits into the prevention that we're talking about today, which will support practitioners from across the care system to develop bespoke scaffolding strategies to help people regain their independence. Now, you might wonder the relevance of all of this to creative activities, when there is a well-established link between creative thinking and executive functioning, with the latter thought to enable them first and vice versa. So if I want to create a painting, I have to plan, I have to organize myself. And so we're therefore proposing that creative activities have the potential to enable people to develop new neural pathways and redevelop their executive function in a way that's difficult to be before. Creative activities help develop people's confidence and social network. They can help people express themselves in ways that make sense to them. That's important. They can help them grow again around their format, so they can stop being nothing but their format and begin to flourish, value themselves, and be valued again in society.
All right. Thank you very much. So it's really, really good. And that's interesting trauma, isn't it? Because I think trauma is often at the root of quite a lot of mental health issues, and the ability to deal with it is something that creativity can address as well, and that can be a preventive measure. So that's really useful.
Hey everyone, I've got notes. I have brain damage, so I'm going to be reading. So I do apologise. So I'm going to take you back on a personal journey more than anything. So I come from a working class background. I grew up in poverty, joined the army as a chef, and travelled the world. After I left the armed forces, I moved to Australia for a few years and then travelled. Finally ended up in London in 2007, where I was the head chef at the exhibition centres, Earls Court, Olympia, Excel, and the Birmingham NEC Centre, and then moved to the BFI in the South Bank before opening my own restaurant in Euston. I worked a lot. 7 days a week, the pressure, stress led me to drink a lot, party a lot, and ultimately this led to me having a stroke back in 2011 when I was only 36 years old. This led to a domino effect of problems. I was admitted to hospital with blood disorder. 4 days later, I was diagnosed with colon cancer. 10 days after this, I had a huge cardiac arrest. Obviously, this is going to cause massive depression, panic attacks. And due to that, I took several overdoses trying to take my own life. I was diagnosed HIV and had a complete breakdown. But for my recovery, I decided to take an arts degree. After my first year, I got ill and I started to lose control again, started drinking, self-medicating and not paying my bills. And on 20th of June 2013, I took a fatal overdose. I woke up in hospital. When I was released from that hospital, I came home to find that my locks had been changed. I was now homeless, and I spent the next 5 months living in my car, obviously going through treatment and stuff like that at the same time. When I started to get back on my feet, to help with my recovery, I concentrated on making art, because why not? Going on and exhibiting in many great places such as Tate Modern, Tate Liverpool, Mayfield Depot, Manchester, internationally in New York, Melbourne, Oslo, the list goes on. And recently at Saatchi Gallery as part of Prince William's Homeless exhibition, which I was also an advisor on. Art gave me back my self-worth, my confidence, it helped with my well-being and showed how resilient I really am. And I know if it can do it for me, it can do it for anyone. I believe everyone can rebuild their lives through art. And so, because of this, I built a homeless arts festival called the One Festival of Homeless Arts, which is still running today. Obviously, this isn't providing housing. I never planned to, right? But it can provide a route to one. It did for me. Obviously, you mentioned that Homelessness International. We do a hell of a lot of research looking at the role of arts within the homeless community. This research can cross over into many communities. Feel free to download it, it's all free. The research provides evidence of ways in which art can produce positive outcomes. The arts can increase well-being, agency, resilience, belonging, knowledge and skills, and the list goes on. Sadly, though, arts within the homeless sector have traditionally been undervalued and never really taken seriously. up until now, and always been seen as an add-on to work that already exists within the sector. But for the first time, it has more value than it's ever had. COVID-19 showcased that everyone should have access to the arts. Overnight, it became as important as medication, helping with isolation, resilience, and mental health in lockdown for many people. TV programs and online art workshops have exploded onto our screens, making the arts accessible to as many as possible. And I believe that art and creativity has to sit alongside housing, healthcare, employment. It's pretty damn obvious why. As I said, it helps build resilience, a voice, well-being and confidence, but also art and culture is human right. It's Article 27 of the UNESCO Charter of Human Rights, and that means that those who are homeless have a right to access the arts and make art. The arts and homelessness sector, though, is young, decades behind other social arts movements such as arts and disability, arts and health, etc. But I put this to you. If there's 150 million people at the moment who are homeless worldwide, it can't just be about housing, right? We have to look at a more holistic model, wrap around of support services with the individual at the centre that includes all aspects of support need, not just the basics. If we get this holistic approach right, with creativity embedded into solutions and working with people, not for them, magic can happen. Like I said, art saved my life. And it got me through my situation when I was homeless. It gave me an escape from all the shit that in my life. It gave me the ability to access support, to rebuild relationships. And it's given me my life as it is today, a successful artist. Now, surely everyone deserves that opportunity.
Hi, everyone. It's a real honour to be here, and a real pleasure. I've still got a story. It's my birthday last week, and I turned 51. It's one of those horrible ages where you go up on the category. I'll no longer be 48 on my profile on Draper. I find that I should mark 30 years being a gay. I was the first gay. Well, not quite gay. I was the first black gay, right? Only started my thought because in 1985, when I started secondary school in this building, they passed a law which stopped anyone talking about homosexuality. It was a pretended family relationship. I think they called it in the law. That law wasn't repealed until 2003. So I came out in this period, and I came out as isolated. And the words of my caring mother, who hadn't watched enough Opher at the time, who said, "Well, you'll be miserable, and you'll die young." And I've looked at the figures. Actually, gay men are miserable and die young. And the activist in me wouldn't allow that to persist. So I remember also 30 years ago being stood on Tottenham Court Road. It's all changed now. Remember those days? You can see for miles. But you stood on Tottenham Court Road and having walked around the block twice, finally ducked into the queue, got to the front of the queue because I, at this point, understood there were some other gays around. And I was met by a bouncer who said, "Do you know what kind of club this is?" I looked up. GAY. I can't guess. Because you don't look gay. So this is my welcome to my so-called gay life. So you can imagine, well, and the explanation given was, well, we get a lot of dealers in here, so that's why we asked you. So I'm welcomed onto this scene, welcome my start of my gay life, which was ahistorical, no history and clearly no future, where lying was encouraged, where the images in my mind were of an iceberg and a tombstone, and I was full of fear, where racism was rife, and I was suspected of being on drugs. And so what does this do to someone's mental health? What does this do? What does this create for a group of Black men who are already at high risk of experiencing poor mental health? So 10 years ago, after finishing a stint leading the Runnymede Trust, banging my head against the brick wall of British racism, I thought I'd take on something a little bit more difficult and deal with the experiences of Black queer men. And I've spent the last 9 years working to understand what those needs might be, and to listen, because nobody has been listening. Next week we launch what we're calling BlackOut Next, and we're using stories to try and build community. So we're using AI, we're using different forms of motivators for dialogue and discourse, so that we can begin to know each other, because we're revolutionary, and Black men loving Black men is a revolutionary act.
Prevention in the NHS.
Yes, yeah. You've very much got the B team to this. I'm very sorry about that. But yeah, so hi, I'm Ross. I'm from the NHS Confederation. And what we are is we're the UK's biggest NHS member body, and we bring together, represent and also support the entire NHS in England, Northern Ireland and Wales. We don't have a branch in Scotland. Prevention is obviously a key political issue for us, and it's a key political issue for it's a key issue for the NHS Confederation as well. And as a result, we're really interested in the power that creative health has to feed into prevention, which a lot of which that evidence we've heard today. So we have a who look through kind of outcome data and spending data and things like that, to demonstrate kind of the value in different health interventions. And as part of our recent report series called Value in Health, we looked at 20 key interventions, health interventions, and their return on investment. So for every pound spent, how much do you get back? It's really telling that the most impactful interventions were those that were associated with strikes, things like that. So for us, this is obviously a key issue, but we're very clear that we can't get that right without looking more closely at how prevention actually works within the system. For us, there are numerous challenges that we feel up getting this right. And the first is really developing an understanding of what prevention actually means. The SCHWeP review last year recommended that there would be a standard definition of what like doing prescribing, education projects and things like that. The problem with prevention is it's a long-term thing. There aren't any really attractive deliverables across that period of time, across parliamentary terms, and we need political leadership that enables us to kind of get towards that. There's also huge challenges to funding, as a lot of you here have said today. There are just so many pots to access. Where does that funding sit? A few years ago, that was completely different. we do think that there is a chink of light there, and there are some key enablers in the system. Obviously, a lot of you here will be aware that health powers are being increasingly devolved to the place-based leaders. So your Metro Mayors through the English Devolution Bill, and greater cooperation between local authorities is being encouraged. And that's kind of the way that we think we need to know those prevention interventions are best delivered by the people that know that area best. So that they know they can target things accordingly. There's a huge opportunity for additional place-based working around what the local area actually looks like. So in a previous life, when I was at NHS Property Services, we did a lot of work around social prescribing and wellbeing gardens that delivered like huge benefits for people experiencing mental health crises and things like that. So that sort of kind of place-based planning work is really important as well, and that's why we're getting involved in the planning and infrastructure bill that's coming over the horizon. The second enabler is really around leadership, which a lot of you will probably chime with. Really, we basically need leaders in the system that understand joint working, and there's been some really good work in this regard in places like Monique will know this in terms of like North of Tyne, in terms of the child poverty work that they've done up there. It's no longer North of Tyne, but the previous work there was pretty impressive. So we need more of that in the system. We need more leaders to take a stand and say that prevention is in a place-based sense, to take a stand and say that prevention is important to them for us to carry this on. And the third enabler is really around data sharing. So as I said before, we don't have much of an idea about what prevention actually means to different people. So how do we get data sharing agreements to develop a holistic understanding of population health needs and what works in every area? So I think my key message to this is we absolutely chime with the fact that creative health is incredibly important in the long term, but we need to get prevention right before we get to that.
Okay, thank you. And that's really really good to have a proper NHS view of it, because I think the trouble with prevention is that you're trying to measure something that doesn't happen. And that's what makes it so difficult to do. But it can be measured, but it's a much more. And the other problem with it is politically, by the time you've prevented a few things, you're probably out of government, so you don't get the credit for it. So in that way, but it's something that we must do, I think. And I think that at least this government has really cottoned onto that. So hopefully we can change what you've been saying about that. Great, thank you very much. Now, lastly, we have a double act, I think, don't we? Is that right? So Yvonne Farquharson, who's the founder and managing director of Breathe Arts Health Research, and also Professor Carmine Ferranti, who's a professor of biological psychiatry at King's College London. So welcome both of you, and you get 8 minutes. So
yeah. Great, thank you. Hi, thanks everybody. So as Simon said, I'm the founder and managing director of a not-for-profit social enterprise called Breathe Arts Health Research, and we combine arts, health and science in equal measure. And the sole reason actually for setting up Breathe 13 years ago is two things that have already been talked about today. One was around developing long-term sustainable programs for healthcare. So really about making systemic change rather than lots of little short-term projects. And the other was around putting scientific evidence and research at the heart of our work. Basically, so I didn't have to spend my life hoping people believe me, but in categorical terms, in scientific, in clinical, in economic terms, I can give you a peer-reviewed medical paper and say, this is the difference we can make and why, using the arts and creativity. So we're going to give an example today of just one of the programmes that we've worked on together, and around that has worked with prevention and the NHS. We've partnered with the NHS for around 13 years now, getting funding from ICGs, back when it was CCGs beforehand, all the acronyms, we've gone through them all over the years. And we're really, really proud to kind of work alongside the NHS ICBs to deliver this work. So the programme I'm going to talk about today looks at an intervention for mothers experiencing postnatal depression. So postnatal depression affects 1 in 10 women, but it's still not that talked about. And actually, very shockingly, suicide is the leading cause of maternal death in the first year after birth. So it's a very, very big problem. It's a very big problem for the mother. It's a big problem for the partner. And it's a big problem for the wider network as it is for the child. And when we're talking today about prevention, we're looking at all of those people and how we can prevent the mental ill health of all of those groups. So what we know is that the NHS is great, and there are some services out there for women experiencing postnatal depression. What we know is there are antidepressants and talking therapies. But what we also know is that women don't access those services a lot of the time. So there's a really big problem there. And they often don't access those services for a number of reasons. It can be cultural and societal stigmas, shame, embarrassment, lack of awareness, not even recognizing that that's what you're experiencing, because everything from the minute you have a baby is about the baby itself. So what we've come up with is an intervention that uses singing to treat postnatal depression. Now, mothers and babies are used to going to mum and baby singing groups, but the difference with this group is not about the baby. It's a completely nursery rhyme free zone. That's important to say. And absolutely everything is about the mum and artistic excellence. So it's around really creating the mother, changing their identity to being one of a creative. But there's many intricately designed aspects of this work, which is why it is beneficial in a health context. And I'll just give you a couple of examples. So we know that women experiencing postnatal depression struggle with social connection. So we teach songs in rounds. Now, to sing a song in round, you have to engage in eye contact. If I'm going to hold the same tune as you, we're going to have to hold eye contact. If you can use singing as a tool to encourage eye contact, that in turn can encourage connection, which is a key aspect that these women are struggling with. Many of these women are isolated and struggle with a sense of community. So we deliver groups in 10 to 12 women, a perfect number so they don't feel a sense of overwhelm walking into the room, but do have a group of women in their local place-based community that they can connect with afterwards. We sing songs that the women don't already know, which means they have to stay cognitively present in the room as they learn, giving themselves a break from the spirals of thoughts that we know can take over. And we teach songs in multiple languages, in 4-part harmonies. And actually, English is probably the least spoken language we teach it, because this is an inclusive group for women, whatever their background is. And it doesn't matter if English isn't their first language. We know that singing and the arts can be a great way of engaging across different cultures. And they're just some of the reasons that singing can work. One of the other things we do is we go into local communities to find these women. We don't expect them to come through the door to us. So we turn up at faith-based groups, at hairdressers, at your local church cafe, and we speak to women in those spaces to let them know about the groups. And we know that women are accessing this service that aren't accessing the traditional therapies. Now, the original research behind this programme, which was conducted in partnership with Royal College of Music and Imperial College London, shows that in just 10 weeks, we can reduce postnatal depression by 40%. Now, that's going to give any antidepressant a run for its money, but it has the added bonus of creating a social connection for these women and a community group that lives beyond those 10 weeks. It's also empowering the women with a tool that they can then sing at home with their baby and connect with their child, and equipping them to not need us long term. And for me, that's a really key aspect of creative health, is upskilling people to live without us. Now, we know through personal stories as well as research that this really works. We had a woman at one of our groups just a few weeks ago who said to me as she walked through the door, "I've not managed to get in the shower for the last 5 days, but I have got here." Now, that shows you the amount of value people put on these groups. Many of these women cannot get outside their front door, but there is something about this intervention. There's something about the holistic offering of creativity and the arts that is getting women into these spaces where traditional therapies, traditional healthcare is not working. So Carmen and I have been working together for the last 5 years, doing a randomized control trial, looking at the scientific and economic impact of singing within healthcare. And I'm going to let Carmen explain a bit about the results, and then we'll tell you our next steps forward.
I mean, I just want to start by saying how great it was to work with Yvonne and with kind of bringing what is the methodology and the thinking behind medical research into creativity, and finding the perfect tension between the structure that allow us to evaluate and create measure the impact that has been mentioned so many times today, while at the same time allowing the freedom of the artist to produce whatever is needed for that group of that woman at that time. And we were really lucky to have funding from the Wellcome to do this randomized control trial. We recruited 199 women, and we extended the previous evidence in 2 ways. So first of all, it's a much larger samples that ever been studied. We also looked at not only the 10 weeks of the singing intervention, which had been tested before, but also we followed up the women up to 6 months after the end of the intervention. And the first most really exciting finding is that the improvement in the depressive symptoms becomes even more evident 6 months after the end of the intervention. So it's really the long-lasting effect on mental health, which I think is kind of, is prevention, because it's preventing these women to remain on a trajectory of ill mental health for maybe more years or in front of them. Of course, it's preventing babies to developing stress and vulnerability for their own mental health problems. We also had, we measured the mother-infant interactions. We could measure in a standardized way by taking videos of the mothers and the babies, how the mothers talk to the baby, how the baby respond by looking at the mothers. And we noticed that, we measured that there was an improvement in mother-infant communication. The mothers would look at the child more, would say more positive things about the child when talking about the child. And crucially, this was not present in the control group. Even if the mothers in the control group were doing, other community-based mother-child activities, yet this particular aspect this particular improvement was lacking. I think this connects to what Yvonne was saying. We're giving skills and tools to the mothers to improve the relationship with the baby. And just the very final point, where the health economists that kind of shouted us throughout the delivery and analysis of the results. And we also demonstrated the intervention was cost effective according to the standardized kind of guidelines. So I think it's kind of both scientifically valid, clinically valid, and economically valid. And maybe just what was the next steps?
Yeah, and there was one other really interesting finding, which Carmen's team looked at around measuring the cortisol levels in saliva, so the stress hormone, in both mother and baby, which was interesting, getting saliva from the babies. And what we found over this, get it off our clothes first, what we found over this period, which is a really brand new finding, is that the mother and baby cortisol levels started to sink during the 10-week period, which is seen as a kind of biological manifestation of mother-baby bonding, which has never been seen before in a setting like this. So, having this amazing research team behind it means that, it's not just the personal stories that we can tell now. In peer-reviewed papers, we can show biological changes in mother and baby and the impact that that's having on preventing long-term, very severe mental health conditions within this community. And we all know that the first kind of, I think it's 1,001 days of a baby's life are so essential to their long-term mental health and well-being. So an intervention that started with us actually really solely focusing on the mum and saying this isn't about the babies has actually made us realise through our research that although it started in that way, we are now having a long-term impact on the baby's mental health and well-being as they grow up into adulthood. And we've started delivering these programs now in children and family centres, because another piece of evidence was that, these children and family centres, which are brilliant, that exist within our communities, are not being accessed by a huge variety of women. So by delivering our programs in there, we're getting women through the door. And one of the most recent findings as well from one of our community centres have said, over 80% of women who come through the Breathe Melodies for Mums postnatal depression programme are staying engaged with children and family centres until their children reach school. Now, that's enabling them to access a lot of other healthcare services that already exist. So the future now is we're working with the World Health Organization, really excitingly, who are using this as a best practice case study as a creative health intervention. And we've just started training teams in Italy, Denmark, Romania, Ireland, Switzerland, Portugal, and soon to be Singapore, to deliver this in their local geography, because we believe we've got a model now that we know can transcend geographies and culture, but we still believe that the individuals in that community know their community best. So we can give them the tools they need to deliver it for their very specific communities.
If I can add 30 seconds. I know we're
30 seconds. I'll be very loose.
There's a keywords in the government strategy, which is digital.
Yeah.
So through COVID, because of the COVID restriction, we rapidly implemented the program online. And we found very similar funding with a much smaller group of women. So we can actually deliver this intervention online for women that for a variety of reasons cannot access it face-to-face. Maybe they cannot live home. It's not available in the local community. So there's an additional aspect of this, which I think is really, really important.
Yeah, thank you. Well, that's fantastic. Really, really good. What a great report. I just thought about that as well. So thank you for that. That's really exciting. By the way, just because you're going to Romania and Italy, don't forget about Stroud, will you? Which is Gloucestershire. We'll have a bit of it there as well.
Yeah.
But really, and what was interesting there, I thought, was that you're going out to a high-risk group and you're providing a preventative treatment, which is I think a really good model for what we're doing. So, there are a few high-risk groups in our society. Actually, young men are a high-risk group as well, postnatal women, and actually targeting them with a preventative thing is good targeted stuff. So, and is it published?
It's just peer reviewing it at the moment, so it will be published within this year.
That'd be really useful. Thank you for that. Okay, I just wondered if anyone has any particular questions they'd like to ask or statements they'd like to make in that way. Is there anything people would like to say? Yeah, Justin. Yeah.
I just want to pick up something Rob said actually. So you might need in Birmingham some of the work we did, and we had matrix public health posts established with 5 of the cultural organisations working on how creative health played out in public health. And one of the things that really struck me from work with one of the museums was the exclusion that arts could do to identity. So when we looked at the collection of Birmingham Museum, which has over 1.5 million items in the collection, and we were looking at it through the prism, first of all, of disability. And the only items in the collection are restraint calipers, things that we use to restrain people with disabilities. But we were also looking at it from the perspective of particularly Black African Caribbean communities with disability and their representation in the museum collection. They don't exist. And it's not unique to Birmingham Museum. Actually, nationally, there is virtually no representation in any museum collection of Black disabled people's experiences. So when we're talking around people's health and giving them visions of what they can aspire to, they're looking for their culture for identity. And if the creative sector is not providing that, if it's not visible, but also acknowledging the gap and the absence, then it's quite hard to have a conversation. So I just think it's important to kind of call that out, because I think Robbie really reminded me of that experience and how much I learned through it.
Yes, thank you, Justin. That's really, really useful. So
I'm somebody who's got lots of lived experience as well. But what I get frustrated with is how we separate mental and physical health. And I think creativity is great at readdressing that barrier, because you can't put your head in one hospital and your body in another. We've got to start looking holistically at people. And creativity can be a great panacea at doing that. And I'm somebody who was told I will always be ill medicated and never work again, believed every word he said, ended up taking an overdose because I didn't want to live with that, and I've proved them wrong. I've been off medication now for 13.5 years, out with services for 9.5. And up until 2 years ago, I worked in the same trust as that expert who told me that, so when I say art saved my life, it was very interesting. When I say art saved my life, I mean art saved my life. But the key thing about art was that it didn't focus on my illness. it focused on my wellness, and that allowed me to develop skills for life. So I'm somebody who's been 40 odd years in the mental health system and about 10 in the physical health system. And when I am stressed, when I reach for the art, it's given me the ability to be able to try something rather than keep going back into the NHS. I describe my journey as being, I've been a passenger in a car of my own life. Everybody else has always had the driving seat. I've never had the confidence or the knowledge to know how to drive my own car. Now I'm driving my own car, and that's what everybody should be doing.
Yes, hi, I'm Ashley Dalton, and I'm the Minister for Public Health and Prevention. What I've been asked to say a few words about today, really, I understand you're focusing on creative prevention and creative arts, etc., as tools for prevention. I hope that you are unsurprised to hear me say that one of the ambitions of this government is to make the NHS fit for the future, and that we've got 3 sort of key shifts that we want to enact in order to make that happen. We have from hospital to community, from analogue to digital, and from treatment to prevention, so from sickness to prevention, rather. So that's why, you know, this is really important, because prevention is almost always better than cure. And obviously there's things that we can't prevent, but where we can prevent, we should really be aiming to do so. You know, whether that's with, you know, the sort of large nationwide prevention programs such as screening or public health interventions, or whether they're more targeted and individual prevention measures targeted at individuals. Because our core objective is about shortening the amount of time spent in ill health and preventing premature deaths. As well as that being quite a good thing for the people involved, it's also, you know, a way of alleviating some of the, you know, acute pressures on our NHS, and also boosting the economy and preventing this vicious cycle that we've been talking about a lot recently of ill health and poverty. And in order to do that, we need to, you know, we need much stronger, more proactive action on prevention. So that we can prevent disease where possible, but also prevent where we've not been able to prevent actual disease, prevent that disease becoming widespread, debilitating, etc., etc. So it can be, you know, people may still have their disease, but that doesn't necessarily mean that they can't live well and productively. So that's what we are looking at doing, and that's all really around reform of the NHS, and we're hoping to be covering that in our 10-year plan for the NHS. And I would encourage anybody that hasn't already gotten involved in that to do so. But what I was really interested in terms of what you're talking about today is how the creative arts play a role in supporting people's health and well-being. And there's so many different ways, of course, that can take place. We do some of that already, or it can be done through things like social prescribing. So people engaging in creative arts in terms of actually tackling their own health and well-being, and using social prescribing models to get people engaged in those services is really good. I also think there's something else that we tend to overlook a little bit in terms of how the creative arts are really important for communicating about health and well-being, for engaging people in our own health and well-being, and helping us to understand different elements of whatever particular disease or conditions or our own health might be. And I'm struck by this because an old friend of mine, who is an extremely talented painter and visual artist, I was unfortunate enough to have to stand next to her in A-level art. and she's absolutely amazing. But she's currently, or was until recently, I think, she's the artist in resident at the Eye Hospital in Manchester, and I did an awful lot of work with patients coming in, engaging patients with the artwork that she was producing, and helping people understand what was happening to them through the creative process. So I think there's an opportunity for us to not only use the creative arts as a social prescribing tool, but also to think creatively about how we use the creative arts, if that makes sense, because it's not just about how we engage in order for our own mental health or well-being. It's about actually how we can use the creative arts to engage everybody in health, in well-being, in the future of our NHS, in how we work together as a society to prevent long-term illness. So I think that's probably all I'm going to say, really. I think there's bits and pieces. I think there's a growing body of evidence that engaging in the arts and cultural activities can be really beneficial for your health. I think, particularly in terms of mental health. I remember talking about young people and mental health and engaging in the creative arts probably 35 years ago when I was a youth peer educator. And it remains true to this day that it's a really useful tool. We know that I understand that in the 2015-17 session, the all-party parliamentary group on arts, health and wellbeing conducted an inquiry into the practice and research in the arts in health and social care. And that report featured endorsements from Michael Marmot, from Lord Darzi, from Duncan Selby, who was the previous chief exec of Public Health England, and a few other names you'd recognise in there. So it's recognised as something that's really important. So we think that social prescribing can work really well, particularly good for people that are socially isolated. But also I think let's look at the creative industries, the creative arts, whether that's literature, visual arts, music, at how we can use them all together as a community. So not just to say these are for people to help them feel better, but it's about all of us being able to go together and prevent us developing some of those illness and preventing some of that social isolation and mental health issues altogether. So I think a couple of things that I wanted to pose, questions to pose to the panel, because as you're in your discussions, we've talked about social prescribing. We've been talking about it for a long time. I think there's a question about how effective that has been in different parts of the country and how effective it has been, not just in terms of the creative arts, but other things such as walking or cycling, etc. So how do we ensure that the creative arts are visible and linked into health systems and decision makers, that people are aware of them and how they can tackle that? And the other question I would ask is, what do we need to consider to ensure that children and young people in particular are able to access creative health in our health services?
Good challenge.
So there's my challenges to you.
Yeah, no, that's fantastic. I'll just repeat those actually. How can we make it more visible and connected? I think that's a good question. And children and young people. Actually, Nikki, do you want to just say a little bit about your proposed project in around the waiting list for CAMS, which is a so could you just say a few?
And it will be with Carmine Pariante's team if we're able to get the funding to King's, working with the South Bank Centre. And, that would be about how we engage the arts to, help reduce those lists, or at least help young people either stay where they are at an absolute minimum, but certainly, what we're looking at is the deterioration of young people's mental health. Some of those lists, as we know, are 2 years long. So, we would be using this fantastic longitudinal research coming straight out of the King's SCHWeP programme to launch that into this programme, which is a great, a lot of this research it's not going to be lost. Of course, there's a lot more to be done with the SCHWeP programme, and as Yvonne has spoken, about, but it's great to be able to take the essence of the learning and all the rigor that's gone around this research for 5 years and then take that into this next programme. Anyway, it all depends on funding. We have applications in at the moment, so watch this space, and hopefully by the next APPG we can say a bit more.
People with learning disabilities who haven't been mentioned today. Children and young people do rather better in life than the over 25s, for whom there tends to be nothing, less than 6% in employment, very little in the way of meaningful activity and opportunity. People who tend not to go to the doctor or to access healthcare, dentistry, definitely not.
Yeah.
I set up a charity which is a creative arts charity, which is basically creating picture stories, where we try to create stories that people can identify with characters in the stories and people from different cultural backgrounds, but telling the sorts of stories about everyday life, about trauma, about mental health, about going to the doctor and the dentist, some with humour, all with solutions. But the important bit is getting people to go to book clubs. And they won't go to the doctor, but they'll go to a book club in a library and read a book together. And that's where they're making friends. And it's creative because they're learning something new. It's all in pictures. It promotes discussion, imagination, and so on. And it gets people together. And actually, people see other people doing it and then they want to join. I think we've set up 70 book clubs in the last year. It's really hard work because most people act as gatekeepers and say, oh, no, you wouldn't want to go to a book club.
Yes.
Okay. Because you've got a learning disability. But actually, this empowers people to read about. So yesterday I was online, you do it online. After COVID, unbelievable. You could do it online as well. But in the library, it's even better.
That's a great idea. I'd just add to that. I used to be involved I was briefly involved in a project in Southend, which was called a Jump Up and Get On or something. And basically a group of young people with learning disabilities, or no, older people, not children, basically went to the local pub on the Friday afternoon, and there was an improvisation session, and everybody just jumped up and joined in, and it was absolutely fantastic. So really interesting ways of getting people engaged.
Fantastic. David, do you want to come in?
Yeah, I've got several points. I agree with the libraries. For my community, the homeless community, they've been fundamental. Just for one example, Leicester Libraries set up a co-produced reading club with the actual homeless community, set it up. They get free food, they get drink. Libraries are amazing. They're just underfunded, and that's something we really need to fund those, because they are open to everyone and they don't judge you, right? And I think that's really good. I just wanted to pick up a couple of things. Sick policy is a big hate of mine. I believe we shouldn't have sick policies. We should be having wellbeing policies, which have a sick policy as part of wellbeing policy. I also think I'd be really interested to know, because obviously there's been a 300% drop in creatives in the UK. So if we do go into the social prescribing in more intense way, how are we going to bring those freelancers back to do workshops and stuff like that? I think that's a massive problem we've got in the creative sector at the moment. Plus, obviously, the creative sector, just with the Royal Academy last week, laying off another 100 people because they've just not got people coming in at the moment. And the reason they haven't got people coming in, and I know this sounds really silly, are cake prices, right? And I know it sounds really silly, right? But if you think the working classes can't afford £8 slices of cake, and if you're going into and you're bringing your family into a cultural centre, and all you've got on offer is a £6 coffee and an £8 slice of cake, how are the working classes ever going to afford that? Because they can't. So they tend not to.
And you don't want the embarrassment of going in and not being able to afford a cup of coffee.
You're throwing ice cream at you and stuff like that. So I think that's one thing. And then I think there needs to be more disabled access as well. As a disabled person, I don't think the cultural centres are actually providing enough. They've always got an opposite door, a separate door. It's right, isn't it? Right? There's always a separate door for disabled people, which then you're being othered straight away. And I don't like that. I think that it should be one entrance for all. That's the couple of things there for you.
Thanks.
Well, luckily that's Lisa and Andy's world, isn't it? Libraries, but libraries.
Well, this is a mission-led government, so
Yeah,
and it's really important that we don't go down this route of saying, oh, well, that's for them and that's for the, it's about how we do things in the round. And I very much believe that, the work that we do around prevention is about making sure not only that we're putting in place public health initiatives, but that we are building towns and cities that make people sick, that we're not creating services that people can't access, and that makes them less able to access the drivers and levers of well-being. It's all wrapped up together, and I think it's really important to remember that this this golden thread runs right the way through all the services that government's responsible for.
Yeah, no, that's fantastic. I was, Lisa and Andy was saying that as well. I was trying to get music in every primary school because I think music instrument teaching could be really good for young people's mental health. And she says that libraries now are going to have facilities to rent musical instruments. So that's another. So I think that's it. That is, as you say, these ought to be joined up and everything. Can I let's have? Would you like to? Yes.
Certain questions or suggestions would be. I feel that a lot of the research is going on and kind of proves it. And I would say that there's somewhat a part for the government to play in communicating this to everyone. Because I think in the same way that physical exercise is now understood to be like key behaviour that you must do, I think the government should be trying to show to everyone that the arts and health is something you can embed in your daily life. And it's not a cost to the government too much, communication piece. So I feel like it's a doable thing.
Yeah, that's well, you just talked to the minister about that, so that's good.
Sorry, I wonder whether with prevention also the word resilience
is
also important.
Yes.
Prevention, because it's not about stopping something, it's about being able to manage.
Exactly. Yeah, absolutely.
Number of projects that have very clearly demonstrated the evidence around what they've been doing, and also the impact that has on the individuals now. Whilst I understand from a population approach, prevention can be a long-term issue that we often struggle with. I've been in public health now for 20 odd plus years, and I've seen the ever decreasing circles that we go in around prevention. And it's often the first thing that's salami sliced when the cuts come in, because they can't see the immediate gain. So I suppose my question and conundrum for us all in this, really strong collective is in the long-term plan. How do we engage our leaders of the future? So we're going to have reduced and different structures in our local areas in terms of local authority and health commissioning bodies. How are we going to tell them that actually arts and culture and these activities that are going on now are critically important? They are economically good in terms of the investment that we give to public funding, and they give as much as importance as the clinical interventions that we keep giving people that don't shift us into that preventative model, so that prevention versus cure. Because we've heard about the difficulties around collaboration, and when we come into financial difficulties we often revert into our own little silos, and it's mine and it's mine. But actually what we need to be doing now is being brave and having one big pot and going, this is all our people, we serve them all together from different organisations. How can we do it? And I think this APPG has a real important role as a social movement to support government. So just that offer really, and social prescribing obviously is one of the ways that we can do that.
And like I said, it's all about joining everything. I love what you said about resilience, because that's absolutely true. I'm sat here with my lymphedema sleeve on, because I'm not very well known, but you get on with it, don't you? And I think there's something there about how do we really build that resilience and use the creative arts to give people those tools because we can't actually prevent everything, but we can actually support and empower people so that they can be more resilient, and we can support each other as a community as well.
Yeah, thank you. I love what you said about understanding. I think that's what it's about. Arts help us to understand. So brilliant, thank you.
And I've been fascinated listening to what's been said over the last 2 hours. My reflection is that prevention is, to paraphrase Michael Marmot, about improving the conditions in which people are born, grow, live, work, grow old. And that needs public investment and it needs coordination. Public investment is clearly going to be very, very hard to come by. There's no excuse for failures of coordination across government. The mayoralties are much better at coordination than Whitehall is. There's no excuse, however, for Whitehall failing to coordinate. And the minister who's just left made some good resolutions about coordination. But what I think I would say, we're going to hear the Chancellor's spring statement tomorrow, if that's what is going to be called. I think I would say that the bleaker the fiscal situation, the more crucial the Creative Health Lifeline is going to be for those for whom it can be made available. The more desolate the scene, the more life-enhancing creative health can be. And the people in this room and the people across the country who haven't been able to be in this room, but maybe the people in the audience who are listening and the people in the audience who themselves are doing fantastic work, and the people in the audience who are connecting with other people who are doing fantastic work, can take some heart from the solidarity that these meetings always help to reinforce, and the sparks and the good thinking that these meetings prompt can take some heart, because what you do when the clouds are dark is give comfort and encouragement and practical help and practical opportunity to the people who so much need it. And if public services are apparently relentlessly under pressure, the pressure never seems to lighten. But the more that pressure, I fear, manifests itself, the more vital it is that the small but tangible and interlinked efforts of the creative health movement count for so much. So, and I'm proud and pleased that the all-party group here, rebranded the Creative Health All-Party Parliamentary Group, continues to carry the flag and to be there to support everybody in the front line who is creative in furthering this creative work and supporting the people who are really doing that work. So thank you, Simon. And thank you, Lord Kamall, for what you're doing, carrying it forward. And thank you, everybody who's participated and everybody who's doing what they do.
About collaboration and mission in government, I think, does give us opportunities, but it is very hard to deliver. And actually, the Joint Health and Work Unit has demonstrated how, when you have a dedicated small team who matrix across 2 government departments, you get real change in cultural practice. Sport England kind of have had a similar, it's not called that, but with the Department of Health on physical activity, huge gains. So if you want to drive it faster and harder, the joint unit with DCMS and DHSE, particularly given the change in DHSE at the moment, might be something to push for.
Great, Justin. And that gives me a plug for a future APPG. I'm not sure which one, but Chris Bryant from the DCMS is coming to that. So I'm trying to get sort of high-level people to do that, but working together, absolutely. Luke.
AI is going to severely impact jobs. We know that I think the Tony Blair Institute said between 60 to 275,000 jobs will be affected a year. So I think homelessness will go up. Our problems will increase. Certainly creative industry jobs like comedians' jobs will be very much impacted. And I think there's an argument for the government for the economic and cultural value of actually supporting social prescribing for the creative industries as a new pathway for careers for them. So instead of them maybe, like as voiceover work disappears, which it will this year, it could be that funding different industries like the comedy industry to go and put on social prescribing during the day, etc. It opens up a new channel to not only help those industries, but it also helps our communities and all these wonderful people here that are doing incredible things on the front line in creative health.
Anyway, thanks for coming. We will have another one in June, and we'll let you know all about that. But I'm going to log you off there, and then we're just going to have a few last words from Lord Kamall, and then that's it, because they're pressing at the door at the moment. So thank you for coming.